Am I audible?
You're audible, ma'am. Good evening to one and all. Yes, I'm audible. Panchajanya, the divine conch of Bhagwan Sri Krishna, which was blown during the Kurukshetra, indicating the start of Dharma Yuddha that followed. Their all efforts were done for the establishment of Dharma. Dharma was kept over personal relations and motives. Keeping the same motive in mind, our organization will work towards establishing the importance and necessity of following and imbibing Bharatiya culture, accepting our roots, and making people realize the true essence of Ayurveda, not only as a treatment modality, but also as a way of life. All this while walking in the path of Dharma. Hence the motto Shreyam Bharatiyam Arogyam Ayurvediam. The founders of this organization started this because we felt the need to spread the knowledge of Bharatiya culture, Ayurveda, the true history of Bharatarashtra, and values to all strata of people in every corner of the world. Also, the founders, being Ayurveda aspirants, know the inside out of today's medical field. Hence, they aim to make people aware of this and also try their best to solve this on the go. With this aim in mind, I would like to welcome you all to Prajnavariddhi, a lecture series conducted for first year students. Joining us today, we have Vaidya Arya Ashok. Ma'am is presently working as Associate Professor in the Department of Shareera Rachana, Vishnu Ayurveda College, Shoranur, Kerala. Ma'am has completed her undergraduation from KVJ Ayurveda Medical College and Hospital, Surya. Ma'am has done her PG from Alvas Ayurveda Medical College and Hospital, Modbidri. Ma'am has presented various scientific papers in various national and international seminars. Ma'am has also guided a research project entitled A Single-Arm Clinical Trial to Evaluate Shira Siddha Yavana Only Diet During Menstrual Bleeding for Primary Dysmenorrhea in Late Adolescent Girls for CCRS Studentship Program for Ayurveda Research KEN SPARK in the year 2022. Ma'am will be dealing with Kesha, Nakha, Danta, Shareera, Asthi, Shareera today. Over to you, ma'am.
Thank you. Your good name, please?
My name is Chinmay Patil. I'm from JSS Ayurveda Medical College, Mysore.
Okay, thank you for the introduction.
It's our pleasure, ma'am. It's our pleasure to have you, ma'am.
Thank you. So can I start the session?
Yes, ma'am, you can start.
Can you see the screen now?
Yes, ma'am, the screen is visible. You can go ahead.
Okay, thank you. So today I'm going to take about the topics Asthi, Kesha, Danta, and Naga, and it is only based on exam, or it is exam oriented. So I'm taking the class on it on basis of the new curriculum scheme, new NCISM curriculum scheme. So first we can see the topics Asthi, Shareera, Kesha, Danta, and Naka, and their distributed marks. So Asthi, Shareera, you can see here in the fourth column, the mark distribution is for 4 marks. Okay, so the Asthi, Shareera, from this topic, for the exam, you will get 4 marks question. So both the topics, Asthi, Shareera and Kesha, Danta, Naka, Shareera, it comes under paper 1, and this Kesha also, the Kesha Danta Naga Shareera also is for 4 marks. This distribution, that is, as I already mentioned, it comes under paper 1, and the distribution for the exam is among the 4 marks, this Asti Sharira, this fourth point you can see here, Asti Sharira, uh, this 4 mark is distributed under MCQ and MCQ, short note essays and long note essays. Okay, so under all these 3 categories, they may ask the Asti Sharira topic. And coming to Keshadanta Naga Sharira, again it's under the paper 1, and for the 4 mark distribution, it can ask question from for MCQ and for the short notes. No long essays can be asked from the Keshadanta Naga Sharira. So according to that, you can prepare notes. Coming to the first topic, Asthi Sharira. So in this, you can see the, according to the new NCISM scheme, they have clearly mentioned which are topics can be studied under this main heading. So under the Asthi Sharira topic, you can see it is classified, or you can study it under 2 different topics. First one is enlist the number of Asthi according to different acharyas. So that is a must know topic. So you have to compulsorily study the topic, and it comes, and how you have to study, you have to know it and the applied aspect of it. This is the explanation for knows how. So this topic you have to study the Asti and also some applied aspect of the Asti Sharira. And the second among this Asti Sharira topic is you have to study about Asti Sankhada and Asti Simanta. So it is also a must know topic, and you have to just know what is Asti Sankhada and Asti Simanta. Coming to the etymology of the Asti Sharira. So as we are having exams within 1 week, so I am just briefing it out the topic. So coming to the etymology, Asti is Asyate iti Asti, that which sustains is called as the Asti. And from the Amara Kosha it is said that As kin mamsa abhyantaraste iti. So that which exists for long is just considered as the Asti. So this etymology, it is very important when we are understanding the number of Astis. Okay. So next, coming to the definition of Asti, Tasmat Chira Vinashteshu Twang Mamseshu Shareerina Astini Na Vinashyanti Sarani Etani Dehina. Okay, so Asti is that which is not getting destroyed. Rather than if you are considering about the Twak, Mamsa, etc., it will get decayed easily, but Asti is not getting decayed easily, and it is the Sara of all living bodies. Next, coming to the Utpatti. So according to Garbhopanishad, it starts, or the Asti starts forming from the 2nd month onwards. Okay, and it is considered as the Pidraja Bhava. Okay, so Asti topic, this all these considered as the Swarupa of Asti. So under this, you can see it is coming under the Pidraja Bhava. Okay, so along with Kesha, Mashru, Loma, Nakha, Danta, all these are stira structures. You can see here, stira structures. All these are coming under the Pidraja Bhava. In Garbha Sharira, you may be studied about the 6 bhavas, and among them, the Pidraja Bhava is contributing for the formation of Asti. Okay. So in the next sloga, they are mentioning about from the dhatu, from which dhatu the Asti is forming. It is forming from the Medho dhatu. You can read the sloga, Resat Rektam Tado Mamsam Mamsan Meda Prajayate Medaso Asti Tado Majja Majja Shukram Tu Jayate. Okay, so what is the importance of this sloga? So while writing the exam, you have to do some smart work. So if you're not knowing a particular sloka that your teacher taught you, so you can utilize the slokas which are related to this one from another topics. So in this, you can see Resa, there is an explanation of Resa, Rekta, Mamsa, Meda, Asti, Majja, all the dhadus explanation you can see in this sloka. So if you are studying this particular sloka, you can give you can write this sloka in whatever dhadus they are asked. Okay, so that is one trick to study. You don't need to study all the slokas that is mentioned. It is very difficult. So you can use these tricks. Okay. So next sloka, Medo yet swa agnina pakvam vayuna cha adishoshitam tadasti samnya labade sasara sarva vigraha. So in the prior sloka we have mentioned that Asthi is formed from Meda. So this is a clarification for it. From Meda, how it is forming. So Meda, with the help of Swa Agni, it gets metabolized, and with the help of Vayu, it gets dried. Okay, so this transformed stage of Meda is called as Asthi, and it is considered as the essence, or we can say it as the framework of all Vigraha, means all living bodies. Next is about the predominance of Mahabhuta. So Asthi is Vayu and Prithvi Mahabhuta predominant. So this you can understand in such a way that Prithvi means it is dense, isn't it? So if you are correlating it with bone, if you are correlating Asthi with bone, you can see that bone is a dense structure. But you can see inside the bone it is so much porous. So that you can consider it as the Vayu Mahabhuta. Okay, so by that you can remember Prithvi, it is Prithvi and Vayu Mahabhuta predominant. Next, coming to the synonyms of Asthi. So in this later slide, you can see it is Pidrija in origin. So you can see here Astri. Okay, Astri it is told. So Astri means, as I already mentioned, it is Pidrija Bhava. So it is originated from the Pidrija Bhava. It is not Stri Bhava. That's why it is mentioned as Astri as a synonym. And Kabala. So Kapala, Palana means protection. Ka means we can consider in this context as the Mastishka. So Mastishka is protected by the bone called as skull. So Kapala can be considered as skull, and also it is coming under the subtype of Asthi, that is flat bone variety. Okay, so next is Medoja. So as I already mentioned in the before slide that Asthi is originating from the Medha. So it is told that Medojam is one among the synonyms. Kikasa, it is a dense structure. It is Prithvi Mahabhuta predominant. So it is called as Kikasa. Okay, and what is the function of Asthi? Dehadharana. Okay, so that is one more synonym. Like that you can remember the synonyms of Asthi. Next, some general information regarding the Asthi. That is, Asthi is having the Ubadhatu, subdivision or the subdhatu of Asthi is Dhanda. Okay, and the end product of Asthi, according to some authors or according to Acharyas, there is difference in opinion, but generally the mala of Asthi is Kesha, Roma, and Nakha. Okay. So in this, you can at least study the Sushruta opinion. So in this, they have what Sushruta says, the mala of Asthi are Roma and Naga. At least this Sushruta opinion you have to study. Okay, so they may ask it for MCQ. Okay, because Sushruta I told, because Sushruta is Shareera Sreshta. Okay, Shareera explanation is better in the Sushruta Samhita. So you have to study at least Sushruta opinion. Next is about the functions of Asthi. Okay, so Mamsanyatra Nibhaddhani Sirabhihi Snayubhistada Astinyalambanam Kritva Na Shiryate Patandiva. Okay, so Astinyalambanam Kritva. Okay, Astinyalambanam. So Asthi is covered by what all structures? Mamsa, Sira, Snayu, etc. structures. Or in other way, we can say that inside or within the Mamsa or inside the Mamsa, Sira, Snayu structures, inner to that you can see the Asthi. Okay, and what is the importance of it? Na shiryate patanti va. It is not getting destroyed easily or fall off easily. Next, coming to the types of Asthi, very important. You have to study this. They can ask it for MCQ also and as a short note essay also. Types of Asti, this sloga you have to study. Etani panchavidani bhavanti tatyada kapala ruchaka taruna valaya nalaga samyani. Okay, again, for the explanation of these types, they have mentioned it as Tesham, Jhanu, Nitamba, Amsa, Ghanda, Talu, Shanga, Shiraha, Kabalani, Dashanastu Rujagani, Grana Karna Griva, Akshikosheshu Tarunani, Parshva, Prishta Urasu Valayani, Sheshani, Nalaga Samyani. Okay. So coming to the types of Asti, there are 5 in number. What are they? Kabala, Ruchaga, Taruna, Valaya and Nalaga. So Kabala Asti, we can correlate it with flat bones. Okay, so wherever you can see that in the Janu region, that we can correlate it with patella, in the Nidhamba region, hip bone, Amsa, scapula region, Ghanda region, zygomatic bone, and Talu, palate region, Shankha, temple region, and the Kabala, which is nothing but the skull bones. Okay, in this region you can see Kabala variety of Asti. Next is about the Rujaga variety that can be seen in the Dhanda. Okay, that is nothing, Rujaga is nothing but Dhanda, or it is a synonym of Dhanda. Next is Tarunasti. Tarunasti can be correlated with cartilaginous structures. Okay, so where we can see that Grana, Karna, Griva, Akshikosheshu Tarunani in the nasal region, auricular region, tracheal region, and in the orbital region, the soft cartilaginous structures, what we can see here is considered as the Tarunasti. Next, about the Valayasti, we can see in the Parshva, Prishta and Uras region. So what is this Parshva region? We can consider it as the back portion of the, that is back region of the ribs, and Prishta you can consider it as the vertebral bones, and Uras we can consider as the anterior portion of the ribs. These are the Valayasti. Next are the curved bones. Next, remaining all bones can be considered as the Nalaga Asti, that is, we can correlate it with the long bones. So, remember this sloga, you have to understand, because for MCQ they may ask like, can you, so they will give some points like, Grana, Karna, Griva, Akshi, Ghanda. Okay, so they will explain. They will ask in the MCQ like, which of the following except one is considered as a Tarunasti. So which among them is a Ghanda? Understood. Next is about the enumeration of Asti. So according to Sushruta Samhita, it is Trinieva Shadani. Shalyatantreshu tu Trinieva Shadani. Okay, so this is very important. Again, I told Susrude, Shareera Sreshta. Shareera Susruta Sreshta. So we have to at least study the Susruta concept. Okay, so in the Susruta Samhita, it is told that it is 300 in number. Asthi is classified as 300 in number. According to modern science, Asthi is, or the bones are 206 in number. And according to Charaka Samhita, it is 360 in number. 360. Trini sashtini shadanyasthanam saha dhanda ullugala nagena. So he clearly explained that this 360 is also by adding dhanda and dhanda ullugala nakha. Okay, dhanda ullugala means this dental sockets. Okay, and also including the nakha. So that's why I told while explaining the this nirukti, I told that asti is, the term asti means that which is not decaying easily. Okay, so this is how you have to understand. So in, you cannot directly correlate asti as bones. Okay, so bones are only 206 in number. So the difference in opinion, it is drastic difference in the opinion of the number of bones is because how they have considered the asti. Okay, asti according to Ayurveda, it is that which is not getting decayed. So the difficult in decaying structures like Danta, Nakha, and the cartilaginous structures, all these can be considered under the asti. And also the time in which they have calculated the or enumerated it. Okay, so you all know that there is the first bone to ossify is clavicle. Okay, so there is it will take almost a adult life to completely ossify all the bones. So if they have taken the classification or numerical explanation of these bones, so if they have taken before or during the intrauterine life, so it can be it is not ossified, right? So there will be changes in the number of it. Okay, so understand, according to Susruta Samhita, it is 300 in number. According to Charaka Samhita, it is 360. And the Ashtanga, Hridaya, Kashyapa, all these are having similar opinion with that of the Charaka Samhita. Next is about the Asthi Sankhada. So this is the second topic among the Asthi Shareera main topic. So this topic is in no topic, must know topic, but it has to just understand it, or you have to just study the topic. You don't want to explain, or the applied aspect of it is not needed. Okay, so Asti Sankhada, it is nothing but the confluence of bones. Sankhada, wherever you can see more bones, that region is considered as Asti Sankhada. So in the first line, they are explaining how many Asti Sankhadas are present in our body. Chadurdasha Astanam Sankhada. Okay, so it is 14 in number, and tesham trayo gulfajanu vangshaneshu. Okay, in the next line they are telling how the 14 sankhadas are distributed in the body. Okay, so among the 14 sankhadas, you can see here gulfa, janu, and vangshana. In these regions, we can see three Asthi Sankatas that is present in the Sakti region, isn't it? In the lower limb region, you can see this Gulfa, Janu, and Pakshana joints. Okay, so we can correlate that with the Asthi Sankhada in the Sakti region, and same can be applicable for the Bahu also. What is Bahu? Upper limb. You can remember as Bahubali. Okay. So Bahu, in the Bahu region also we can see the Manibandha, Kurpara, and Kaksha Sankhadas. Okay, and the remaining are in one in Triga region and one in Shiras. Okay, Triga means where the lower back, where the scapula and this hip bones join. That region can be considered as the Triga region. Okay, so counting all these, we will get 14 Sankhadas. Next is Simanta. Okay, Simanta is again 14 in number. Chadurdashaiva Simanta. Techa Asti Sanghadavat Gananiya. Okay, you have to classify same as that of the Asti Sankhada. Yadasthir Yukta Asti Sankhada. What do you mean by that? Simanta is also 14 in number. You have to classify it same as that of the Asti Sankhada. So it means that wherever you can see Asti Sankhada, in those places you can see Simanta also. Okay, so we can consider these Simantas as the binding structures or the ligaments which are binding these bones. Okay. He Hyukta Sanghadaste Ghalwa Ashtadashaikesha. Okay, further here Susruta is explaining that, but some other authors' opinion is 18. Okay, some other authors, Semanta is considering, or the enumeration of Semanta is 18 in number. Okay, so for this, the Dallana has given one clarification that this 18 number or the 4 added semandas may be present in the pelvis region and the chest region. Okay. Next, coming to the next topic, Kesha, Danta, and Nakha. So, according to new NCIs and syllabus, you can see here the distribution. This topic, Kesha Danta Naga, you have to study under five criterias. Okay, so the first one is Panchabhaudika Swarupa of the Kesha Danta Naga. Next is Swabhava of Kesha Danta Naga. The third one is the Prabhuda or the normal Swabhava of the Keshadantanaga, and next is Vikrita Swabhava of Keshadantanaga, and next is how we can utilize Keshadantanaga examination for diagnosing other diseases. Okay, and this carry, as I already mentioned in the starting of the class, it carries 4 marks and it comes under the paper 1. And from this topic, we will get MCQ and short note essays. Okay, no long note essay will be asked from this topic, and it is a must know topic. You have to study this and you have to understand how it is applicable in your clinical in your further clinical classes. So, starting with the first topic of it, Panchabhaudika Swarupa of Keshadantanaga. So, you can see here, Tatra Yet Visheshadaha Sthulam Stiraha Murtimat Guru Ghara Kadina Mangam Naga Asthi Dhanda Mamsa Charma Vacha Kesha Smashuloma Kandhara Adi Tat Parthivam Gandho Granam Cha. Okay, so in this you can see that Panchabhaudika Swarupa of Danda, Nakha and Kesha is Parthivam. Okay, Prithvi Mahabhuta predominant. In the prior class, I told that Asthi is Parthiva. Asthi is predominant of Prithvi Mahabhuta, and along with Prithvi, Vayu is also predominant in the Asthi. Okay, so in this you can see that is predominant of Prithvi Mahabhuta, Nakha, Danta and Kesha. These 3 structures are predominant of Prithvi Mahabhuta. And Swabhava, you can see here all these Kesha Danta Naga are Pidrija in origin. Okay, same as that of the Asthi. Okay, so there is so much relation between Asthi and this Kesha Danta Naga, because Asthi, Ubadhatu of Asthi and the Mala of Asthi is related with these structures. So it is all these Asthi, Kesha, Dhanda, Naga, all these are Prithvi Mahabhuta predominant, and its Swabhava is Pidrija, or it is originated from Pidrija Bhava. So why have to understand this? So Prithvi Mahabhuta predominant. So its application comes under the disease aspect. So if you are having any diseases related with Kesha, Danda or Nakha. Okay, so in case of Asthikshaya and Asthivriddhi Lakshanas, you can see Patana of Kesha, Danda, Naga, Ghalitya in Pitta Vriddhi Lakshanas, you can see early Palitya, Ghalitya, etc. So in all these conditions, you have to understand that you have to follow both good diet and a good treatment principle. Okay, so in case of Patyahara, in these cases, you can give Prithvi predominant foods, okay, or the foods that is giving Parthiva. All dravyas are Sarvam Dravyam Panchabhaudikam, but among them, if you are having or if you are utilizing the Parthivatva of food, then we can prevent these diseases. And also this Pidrija Bhava. Okay, so if you are utilizing the so it is the genetic, it is in relation with the genetics. So in this we can see that the bija is Stri bija and Pumsa bija. So in the case of Pum bija, if you are looking for the healthy Pum bija, and if you are at the time of fertilization also, it is this is also carrying very much importance in case of disease resistance and all. Next is about the Prakrita Swabhava of Kesha. Okay, normalcy or the now what is a normal Kesha Lakshana. Okay, so first before that I will give a little bit introduction about the Kesha. Its Utpatti Kala according to Charaka Samhita is seventh month, according to Ampada is sixth month, and according to Harita Samhita is fourth month. Okay, and it's the Ubadadu of Majja. Okay, again, this can ask for MCQ, and it's Mala of Asthi. Next, Sankhya Shareera. According to Sushruta, Kesha is innumerable in number, but according to Charaga, you can see here it is 29,956 in number. Okay, so you can remember this number. Next, Prakrita Swarupa of Kesha. Okay, so based on the Prakriti, this Prakriti you may be studied in the Kriya Shareera. So you don't want to study this specifically in this topic. So if you have studied this in Kriya Shareera and you can utilize that idea in this, so you can see here mainly there are three Prakritis, Vada, Pitta and Kapha Prakriti, and authors have explained in each Prakriti how the Kesha will be. Okay, and what is the importance of it? By understanding the characters of Kesha, you can give a clue, get a clue about the prakriti of person, and you can utilize that information in the clinical aspect. Because in Ayurveda, the basic rule of Ayurveda, we are not treating the disease, we are treating the patient. So you have to understand the prakriti of a person. Okay, so I am just see the Sushruta Samhita reference. Okay, based on the Prakriti, you can see Kesha is the Vata Prakriti person. Kesha is Fudida, Alpa, and Ruksha. Okay, and the Pitta Prakriti person, they have mentioned, Acharya has mentioned it as there are chances for early graying in Palitya, early graying, that is Palityam, and early baldness. Okay, so what you have to, how you have to understand this? So the Pitta Prakriti person, there is a chance in Ashtanga Hridaya also they are mentioning the same thing. Okay, so there are chances of early graying of the hair. So prevention is better than cure, so you have to prevent it by taking Parthiva Dravyas, etc. Okay. Next, the Kapha Prakriti person will be having Sthira, thick and dark colored Kesha. In the Dirghayu Lakshana of in Charaka Samhita Shareera Sthana, they have explained the hair which is mridu, alpa, snigdha, subhadda mola, deep rooted, and Krishnavarna. Krishnavarna means black color Kesha is considered as good, and the person with these characteristics of Kesha will live long. Okay, and in the Medo Sara Purusha, what is Sara Purusha? The essence of Dadu in its excellent quality. Okay, so this Meda Sara Purusha, under this you can get explanation of the Kesha, Loma, Nakha and Danta. Okay, so all these Kesha, Danta, Loma, Nakha should be anxious. Okay, or the Meda Sara Purusha persons, Kesha, Danta, Nakha, Ostra, Mutra, Purisha, everything will be anxious in the is the Lakshana of it. Coming to the Danda, you can see that the Utpatti Kala is fourth month onwards, and it is, you have to clearly mention it is after birth. Okay, and you can see that it is the Ubadhadu of Asthi, again an MCQ question, and you can see here the Sankhya Shareera of it. It is 32 in number, Dwa Trimshat Dhanda. Okay, again it's an MCQ question. Next, types of dhanda based on the eruption. You can see Sagrat, Jada and Dvija. Sagrat Jada means it the dhanda that which is originate or emerging only once or erupt only once. Dvija means erupt twice. Okay, based on the morphology, it is classified as four. Rajadanda, that is middle incisor. Vasta, lateral to the incisor, you can see 4 extra dhandas that can be considered. This 4 classification is from is by upper and including upper and the lower jaw. Okay, next is Damstra, canine, and Hanya, molar and premolar teeth. Next, Prakrita Swarupa of Danta, based on the Prakriti. Again, you can assess the Prakriti with the help of Danta. Okay, so in this you can see Charaka Samhita, he has mentioned only about the Vada Prakriti Danta, that is, it will be Parusha. Okay, in Bhela Samhita, he has mentioned the Kabha Prakriti Danta, that is, it will be well arranged teeth. Okay, and in Harisa Samhita, he has explained Vada and Pitta, that is, it will be Sukshma Danta, that is, it will be small in number, the size will be small, and it will be, and the Pitta Prakriti, it will be Vishuddha Varna Danta. And according to Ashtanga Sangraha, it is Thanu, Ruksha, and Alpa. Okay, so at least you remember this Charaka Samhita explanation. Okay, then based on Dhadu Sara Purusha, you can see explanation or information about Dhanda in Medo Sara, Asthi Sara, and Shukra Sara. Okay, so in Medo Sara Purusha, as I already mentioned in the Asthi explanation, unctuousness of Kesha, Loma, Nakha, and Dhanda can be seen. Okay, and in Asthi Sara Purusha, you can see the Sthula Dhanda can be seen. In Asthi Sara Purusha persons, the Dhanda will be Sthula. Okay, Shukra Sara Purushan, the Dhanda will be Shveda Varna. Okay, just get a rough idea about it, because they may ask this in MCQ. Next is Nakha. The term Nakha means Na plus Kha. Okay, Kha means Srotas. Okay, that which is not having Srotas is considered as Nakha. Its Utpatti Kala is 9th month according to Garbhopanishad, and Sankhya Shareera is 20 in number. Okay, Vimshad Nakha. Next, the parts of Nagha. The first one is Naga Agra. Tip of the Nagha is called as Naga Agra. Next is Naga Mamsa. Nail bed is considered as Naga Mamsa. Nagandhara is hyponychium. Okay, what is hyponychium? The tip of the Naga, the gap between tip of Naga and the fleshy part. It is considered as the Naga Andhara. Next one is Upa Naga, lunula. This is in your hand. If you see, you can see a lunar-shaped white patch that is considered as a Upanaga. And Acharyas, Ayurveda Acharyas will consider this as a examination criteria for understanding the diseases. This size of the Upanaga is considered. Next is Prakrita Swarupa of Naga. Okay, so again the Prakriti concept, according to Sushruta, he has explained Vata Prakriti person's Naga, that will be Ruksha, and in Pitta Prakriti that will be Tamra Varna, coppery. Okay, he has not explained about the Kabha Prakriti person, but instead in the Rektasara Purusha Lakshanas, Acharya has explained it as Snigdha Rekta Varna Nagha. Okay, so Rektasara Purusha's Nagha will be Snigdha and Rekta Varna. In Medho Sara Purusha, again we have seen it before. It will be unctuous. Nagha will be Snehatwa, or the oiliness will be there. And this Astisara Purusha, the Nagas will be Sthula in nature, and Shukrasara Purusha, it will be Shweta. It is not white in color, it will be white tinge will be there. Next, Vigrita Swarupa of Kesha Dandanaga. In this, you can see the Asthi, Kshaya, and Vriddhi Lakshanas. In this, Vigrita Swarupa means the vitiated conditions of this Kesha Dandanaga. So, in Asthi, Dhatu is very much relation with Kesha Dandanaga, and vitiated condition of Asthi Dhatu can directly affect these three structures. Okay, so in case of Asti Dhatu Kshaya Lakshanas, you can see here Asti Nyasti Toda Sadhanam Danda Kesha Nagadishu. You maybe studied it in Ashtanga Hridaya. You can utilize that sloga. Okay, Sadhanam Danda Kesha Nagadishu. They can be falling off Danda Kesha and Nakha in case of Asti Kshaya Lakshanas. And in Asti Dhatu Vriddhi Lakshana, in case of Danda, Asti, Adhyasti, Adhidhandasha. There will be excess growth of danda in case of asti dhatu vriddhi lakshanas. Next, coming to pradosha lakshanas. Pradosha is this Charakacharya has not explained vriddhi lakshana. Instead, he has quoted the term pradosha lakshanas. Okay, so in that you can see here adhyasti dhandau dhandasti bheda shulam vivarna keshaloma naga smashru doshascha asti pradoshaja. Okay, in this you can see that dhanda asti Bheda will be there, pain, splitting of danda asti will be there, pain will be there, discoloration will be there, keshaloma naga smashru dosha, abnormalities will be there in keshaloma naga smashru. Okay, all these are the Vikrita Rupas of Keshadanda and Naga. Next, the last topic point under the Keshadanda Naga is importance of Keshadanda Naga as a diagnostic tool, and it is very important for your further studies because this especially Naga is considered as a diagnostic tool in Ayurveda for diagnosing the diseases. Okay, the first one, as I before I mentioned that the Prakrita Swarupa, under the Prakrita Swarupa, I have mentioned that by the help of Kesha Dhanda Naga, we can identify the Prakriti of person. So we are treating the patient, not the disease. So it is very important in Ayurveda to understand the Prakriti of person. Okay, so with the help of these three structures, we can identify or we will get a clue about the Prakriti of person. Okay, so that is one importance of understanding Kesha according to Prakriti and yeah, Astikshaya Lakshanas. To understand the Astikshaya Lakshana, you can see that here there is falling of teeth. Chadanam Dandakesha Nagadishu, I told before. Okay, so if any symptoms can be seen in patient, you have to treat the Astikshaya Lakshana. Astikshaya, okay, Asti Dhadu, or we have to treat the Asti Dhadu. Okay, and in Prameha Purva Rupa, you can see excess growth of Kesha and Dhanda. Okay, and there will be excess growth of Kesha and Nanda. Also, in the Purva Rupa of Kushta, you can see Loma Harsha. Okay, Loma Harsha means horribulation. Okay, so all these are the clues to diagnose a disease. Next is in Arishta Lakshana, that is explained, this explanation can be seen in the Charaka Samhita Indriya Sthana. In Arishta Lakshana, it is explained that if the patient is not having any pain on plucking his own kesha, and there will be unctuousness in the kesha even without applying any sneha, then that patient can die within 6 days. Okay, so that is one Arishta Lakshana related to kesha. Next, in under the Dhuda Lakshanas, again in the Indriya Sthana, they have explained that so before, prior to visiting a Vaidya, if the Duda touches Kesha, Nakha or Dhanda, then the patient will die. Okay, that is one Duda Lakshana. Next is about the Pradosha. Pradosha means again vitiation of Rasadhatu. Under the when Rasadhatu is getting vitiated, there are chances for getting Palitya. Palitya means graying of hair. So before I told that if Palitya occurs, you have to treat the Rasadhatu and also you have to treat the Pitta. Okay, we have to make the pitta balanced. Next, pradosha of meda. In this condition, or if the meda dhatu is vitiated, there will be jadili bhavam of kesha, or the meeting of kesha can be seen. Okay, so all these are the indications for understanding whether the doshas or dhatus are vitiated. Next is Asthi Pradosha Lakshana. Under the Asthi Pradosha Lakshana or the Asthi Dhatu vitiated Lakshana, so you can see there will be excess growth of teeth, splitting and severe pain in the teeth, discoloration, and there will be abnormalities in Kesha, Dhanda, and Smashru. Okay. Next, again, specifically in Ayurveda, you can see Naga is utilized as a diagnostic tool in various diseases. I have noted only little bit among them. Okay, so in case of Arshas, Vada, Pitta, Khabha, Arshas, you can see difference in the in naga color. Okay, it is not like you will see a dark black color of nails. There will be a tinge in the naga, which is dark in color. In Vada Prakriti person, you can see there is a blackish tinge on his naga, and in Pitta Arshas cases, we can see yellowish tinge in his naga, and in Kaba Arshas cases, you can see Shweta tinge on his naga. Okay, so the same can be applicable for Jwara and Gulma. Almost the Vada, Jwara, and Gulma cases, there will be blackish tinge will be there. Pitta. Jwara and Gulma cases, there will be yellowish tinge in his on his nails, and in Kaba, Jwara and Gulma cases, there will be Shweta tinge on his nails. Okay, by this we can differentiate what dosha was vitiated in case of these diseases. Okay, and as I told before, in the Purvarupa of Prameha, to understand it is the Purvarupa of Prameha, you can identify the nega. If there is excess growth in the nega, that can be prameha, and you have to consider, not only consider single criteria, you have to consider the person as a whole. Okay, next is about the Rajyakshma Purvarupa. In the Shreya condition, you can see Nakha Adivriddhi can be seen. Okay, and in case of Kamala, so that you may be knowing, in case of Kamala or this jaundice cases, you can see the whole body is having a yellowish tinge along with the tinge in the nagan, akshi, etc. Okay, and in case of poison, if you have touched poison, or if you if touch a food which is poisoned, in that cases there are chances for shedding of nails. Okay, so all these are, there is only little bit explanation about this diagnostic tools, but understand that this Kesha Danta Naga is drastically used as a diagnostic tool in Ayurveda. Thank you, everyone. So in the next slide, I have given some MCQs. So it will be good if you answer by unmuting it. Am I audible?
Yes, ma'am, you are audible.
Okay. You can just answer this MCQ. It's only the 5 MCQs are there. Just to check whether it is utilized. Okay, the first question, Asthi Sankhya according to Charaga. Okay, so in this you can see here the points are or the MC multiple. It's a multiple choice question. In this, the first point is it is 300, 240, 360, and 204. So according to Sustruda, it is 300 in number, and according to Charaga, it is 360 in number. So the answer is option C. Okay, 360 in number. Okay, so next, number of Asthi Sankhadas. Asthi Sankhada means the confluence of bones. So, what is the number? Chadurdesha Asthi Sankhada. It is 14 in number. So, if the question is C Manda, then you can say the same answer. It is also 14 in number. Okay. Next, examples of Tharunasti. Okay, so in this, they can replace this Tharunasti with other types. Okay, so you have to, that is why you have to understand the, or you have to study the types of Asti. Okay. Next, number of asthis and chagas. So, according to Sustruda, he has classified this 300 number into Shaka Gada Astis, then Madhyama Sharira Astis, and Jatrurdu Astis. Okay, so among them, Shaga Astis are 120 in number, and Madhyama Sharira is 117 in number, and Jatrurdva is 63 in number. So, this is the number of Asti in Shaga. So, the answer is 120. Okay, and Kesha is the Badadu of. Can you explain? Can you tell me the answer? Can anybody tell the answer?
Somebody has commented as Asti Dhatu, ma'am. Option A.
Okay, so we can just clarify it. Okay, so under the Asti Dhatu, you can see here. So the Upadadu of Asti is Dhanda. Okay, so what was the question? Kesha, Upadadu of Asti is Danda, and according to the Mala of Asti, and sorry, in this you can see here the Mala of Asti, they have mentioned it as the Kesha, Roma, and Naga. And under the Asti Ubadadus, they have not mentioned it as Kesha, it is Dhanda. Okay, so the Ubadadu of Kesha or Ubadadu, Kesha is considered as the Ubadadu of Majja actually. Okay, so the answer is Majja. So you have to understand this slide. Ubadadu of Asti is Danda. Ubadadu of Majja is Kesha. And Kesha is also considered as Mala according to some authors. Okay, this is an MCQ. This will be an MCQ question. Clear? Any doubts? And while writing the Asti Shareera or the Keshadanta Naga Shareera, you can utilize it from the other topic also. Okay, you can utilize the slokas from Prakriti. You can utilize the slokas from Sare Purusha. All these things you can utilize. You don't need to only study on the slokas which your teacher has taught you. Okay, you can utilize the slokas which are related to these structures, and it is better to write these in a table form or schematics form or in a point by point. Okay, no need to write Ayurveda topic in a history, or the Rachana topic in a like a essay. Okay, So if you're presenting like that by drawing schematic diagrams, tables, etc., it will be more presentable.
Yes, ma'am. I don't think there are any doubts as you have explained the topic quite well.
Okay, ma'am.
Despite of a busy schedule, thank you, ma'am, for joining us. We would love to collaborate you again in the future. And I hope the people who have joined us live and the people who will rewatch the stream will benefit a lot from the knowledge session shared by the Arya Ashok, ma'am. We are delighted to have you, ma'am. Thank you for the wonderful session. It was very insightful, and I hope it will be useful for everybody who will watch this. Thank you, madam.
Okay.
On
If you
behalf of
want a
Panchajanya
slide,
team, I
you
would
can
like to
just
extend my gratitude.
ask.
Yes, ma'am. Yes, ma'am. You can continue.
I will share the slides. Okay.
Yes, ma'am. I'll make sure I'll forward it to the students. Okay.
So
On behalf of
thank you
the
for giving
Panchajanya
me this
organization,
opportunity.
yes, ma'am.
Yeah. Okay. And your students are having exams starting from 15th, I think.
Yes, ma'am.
Okay, okay. So all the best, dear students. No need to worry and attend all questions. That is very important. And in Rajna Shareera paper, it will be good if you're drawing pictures wherever necessary with neat uh, labeling. Okay, and there is no necessary to draw diagrams for Ayurveda topics. Okay, and if you're utilizing schematic and tables, that will be well and good. Hmm? Understood?
Yes, ma'am. On behalf of Panchajanya team, I would like to extend my gratitude to Vaidya Arya Ashok ma'am for dedicating her time despite of her busy schedule. We are very grateful, ma'am. Thank you for joining us.
Thank you. All the best, dear students. Be a good doctor.
Thank you, ma'am.